You know what is risk? In quality assurance in a pharmaceutical company or any other companies also, whatever the company is there, whether it is pharma, food industry, nutraceutical, automobile company, leather company, garments company, any company, everywhere there is a risk. Today we will learn about risk management and audit and compliance. Two major things are there. Then what is that risk and how we have to evaluate the risk and how to mitigate the risk. What is the risk? Can anybody tell? What is the meaning of risk? Just I am giving an example. Okay. What is the difference between hazard, risk, and harm? Hazard is related to some object or substance or some process. And if you are handling that one, then there is a risk. Okay. For example, there is a knife. Is my screen is visible? Please mention yes. Okay. Just consider there is a knife. That is a hazard. If it is kept aside, then there is no problem with that knife. But if somebody is handling that knife, somebody is touching that knife, somebody is catching or using that knife, then there is a risk. What is that risk? Exposure to your hand, exposure to the hazard is called risk. If you are not managing, if you are not handling, if you are not find out the accurate procedure how to catch or how to handle that knife, then there is a risk. And it results in harm. What will result in harm? If you are not handling that knife properly. It is not related to knife, it is related to all type of hazards. If you are not handling your hazards, that hazard may be microbiological hazard, that may be physical hazard, that may be chemical hazard, that may cause any type of injury to our body, that may be physical injury, that may be health injury also. Okay? Not only to the patient health, it may be related to our product also. Not to direct operator or officers or employees working in the pharma plant. It may affect to the patient which is carrying, which is consuming our product. If there is a risk with respect